First it was your nose, then it was your throat. Now your saliva can be used to test for COVID-19. I'll tell you all about the new test, plus where to find it.
We've seen COVID-19 testing ramp up in the valley. The surge in testing caused a backlog, though. You could be waiting a week or more for results. Fox 5's Cassie Milnerick is live from a local clinic with a new kind of test you can do from home.
Yeah, I'm outside of E7 Health. It's the first clinic in Southern Nevada to actually offer an at-home saliva test kit of this kind. It's been available for about 2 weeks now, and the clinic says that some patients are willing to pay up in order to skip an uncomfortable swab or maybe hurry up their results. Access to COVID-19 testing has only increased in the valley, but easy access also means you could be waiting a while to get your results.
We've been hearing from patients that it can be, a week up to 2 weeks.
Layla Ayakabuchi is the director of preventative health and travel medicine for E7 Health in Las Vegas. Like most clinics in the valley, it handles COVID-19 testing, but it's one of the first to do it differently.
So you just take this tube and you spit into it. It takes about a half an inch of spit there.
It's a saliva test. The FDA approved this form of at-home testing back in May. Patients can order a test through E7 Health. The test can either be shipped to your home or collected through contactless pickup. Spit in the tube, screw on the cap, shake it for 5 seconds. Shaking releases the blue solution that activates the RNA of the virus. Ship it back for results in as little as 2 to 3 days.
This lab at this time has the capacity to take tens of thousands of tests without any delays.
But how effective is a saliva test?
So this test is highly accurate. It's at least the same accuracy or more accurate than the nasal swab. And the reason for that is the nasal swab is very dependent on the collection itself. There could be collection errors where the Q-tip may not go back far enough. It may not get enough of the virus on the Q-tip. Where in this test, as long as there is actual virus in the saliva, it will pick it up.
The test has appeal to those needing quick results or those wanting to avoid an uncomfortable nasal or throat swab, but expect to pay for the convenience. A saliva test isn't cheap. It'll run you $159 plus shipping.
It's just based on the lab fee, so obviously it's not an option for everybody, but it is a convenience option.
And if the price is sort of puts you off, E7 says check in with your insurance because this FDA-approved test might actually be covered. They say all their patients here are given an itemized bill from the lab so that you can possibly get some form of reimbursement. All right, reporting live, Cassie Milnerick, Fox 5 News, local Las Vegas.